of clusters and some community transmission across a number of different areas, mainly centred on Catalonia in the north east of Spain. And again, as measures have been relaxed and mobility has increased, we've seen the number of cases rise. But the situation is nowhere close to what it was there before. And the authorities certainly assure us that they're taking every possible measure to investigate and suppress clusters and taking localised action to suppress those new clusters of disease. So I think Spain has developed a very sensitive surveillance system. It's able to detect these clusters very quickly, and again is very open and transparent about how it communicates those clusters to its population so people can take action. So I think it will take a number of days or weeks for us to see what is the future in Spain, but we trust that with this open approach, with this sensitive surveillance, with the sustained testing and with the cooperation of people in Spain, that we will see these clusters come under control in due course. But complacency is not an option, and we do not believe that the government of Spain is being complacent. In fact, quite the opposite. They're being responsible and being very open and aggressive in their surveillance strategy for the country.
Thank you very much, Dr. Ryan. And on that note, I think it's time to close this press briefing. I'll just hand over to the Director General for final remarks.
Just make one other point, because Meg spoke really well on hepatitis C, but just a shout out to all those people who were working on hepatitis B for so long, 20 years now, and to see incidents less than 1% in children it is incredible. And I think sometimes the unsung heroes, and we see the impact that vaccination can have. But vaccination is not enough. It takes hundreds of thousands, millions of health workers and communities and mothers and children and so many others to make vaccines have their impact. And for those who see the impact of Hep C and see the treatments come, but also avoiding hepatitis B, it's been a scourge in many, many countries for so many decades. So just a shout out and a chapeau to all our colleagues working in vaccination on this. It's a huge success. I know it doesn't sound like it, but we should take these successes because they're true victories for global health. Well done, Meg.
Well, also just to invite people tomorrow, because tomorrow is World Hepatitis Day, and the slogan we have is a hepatitis-free future, and the fact that we've already made one SDG target of less than 1% hepatitis B prevalence among children under 5 is amazing, and we need to continue that momentum and bring it to all parts of the world. And so tomorrow we'll be having a high-level conversation about how we can bring it to the last parts of the world, including Africa, who really needs to step up on the vaccinations and prevent this from mothers to child, and to use the guidelines that we're launching tomorrow as well. So thank you very much.
Yeah, I would like to join Mike and Meg. I think having a good news in the middle of the pandemic is not bad. In under 5 children, putting hepatitis B less than 1% is really a success. And we would like to use this opportunity to thank health professionals all over the world for their hard work to make this happen. As you know, hepatitis is a lifelong, actually, problem. It can stay with you through adulthood, and it's like a time bomb, and everybody knows it. And a major health problem, and killing more than 1.3 million people globally. It's serious and a very silent killer, by the way. So having a progress in hepatitis B is very significant. So we thank all health professionals, all who have been involved, and also our team here, and also from our partners. And especially shout out to our London School